Hey guys, in this week's video I'm going to tell you everything you need to know about when you might be pregnant. So we're going to be going through those early signs to be looking out for, when to do a pregnancy test, what to do if you are pregnant, and when to seek medical attention, and loads more. Now this is going to be quite a long video, jam-packed, full of information, so if at any point you want to find any specific piece of information, feel free to click in that description below, click on a chapter that you want that's relevant to you and watch it, because I know you're a busy person and you might want to find that advice quickly. However, as I always say, I would highly recommend that you watch the entire video and become a bit of a pro at it. Okay, so let's get into it. So the first sign that you need to be aware of that might indicate that you're pregnant is a missed period. So if your normal menstrual cycle is 4 weeks, it can be longer, it can be shorter, but let's say it's 4 weeks on average, and you missed your period, then there could be a chance that you're pregnant. However, please note, please remember that certain things can delay your period as well. So if it is just delayed and by a few days and then you have it, obviously it means that you're not pregnant. And there's a variety of things that can delay your period. For example, if you're under a lot of stress, if you've got any medical conditions, for example, if you're diabetic, if you've got thyroid problems, if you've lost a lot of weight, if you put on a lot of weight, loads and loads of different things can delay the period, including a contraceptive pill as well if you're on that. So please bear that in mind. I will also leave a full list of different things that can delay the period in the description below as well. Now it's important to note that yes, when you are pregnant, your period stops, but this isn't entirely true, because when you initially get pregnant, so when the egg implants the uterus, you might have a very little bleed, a very little period, a very light one, much lighter than normal, a few drops. This can happen, but then your regular period will stop. Now, if your period is more than 7 days late and there's a possibility that you could be pregnant, you should take a pregnancy test. But you can take a pregnancy test even from the first day of your missed period if it's been 3 weeks from the last time you had sex. Moving on to sign number 2, 80% of women can suffer from nausea. If you don't know what nausea means, it just means feeling sick, that sickness feeling. So a lot of women who are pregnant do get this symptom of feeling nauseous and also vomiting, also commonly known as morning sickness. However, I don't think it's a very good name, because the morning sickness or the nausea and vomiting can happen throughout the day, at night, through the day, so maybe we should just call it sickness. Now, not all women get the sickness associated with pregnancy, and it usually starts about 4 to 6 weeks within pregnancy and usually lasts up to about 20 weeks of pregnancy. Now, please remember, if you don't think you're pregnant, or if you are pregnant and you're suffering from the sickness, then please do speak to a healthcare professional about it. There's many things that they can do to help you with it if you are suffering with it. And as I mentioned, if you don't think you're pregnant and you are feeling sick, you're feeling nauseous, please do get that checked out. It can be a variety of different reasons as to what's causing it. You could be having gastro issues, you could be having some underlying medical issues that need investigating. So it's super important, if you are suffering from nausea and vomiting and you don't think you're pregnant, get that checked out. Now moving on to sign number 3, feeling tired all the time. Now it's normal to feel tired after an exhausting day or on days where you might not have had enough sleep. It's also very common to experience tiredness if you suffer from things like depression or an underactive thyroid or iron deficiency anemia, which I will leave loads more information about in the description below. But if you have been feeling increasingly more tired than normal, especially if it's accompanied with feeling more emotional or sick too, this could be an early sign of pregnancy. Tiredness is normal to experience through the whole of pregnancy, and in the first 12 weeks, it's often due to all the hormonal changes that your body is going through. Now, whilst we're on the topic of tiredness, please do remember long-term tiredness. If it's been going on for a while and you might not be pregnant, or if you are pregnant, it's still a good idea to get it checked out by your healthcare professional, because again, there could be various underlying factors that are causing this. So please remember, if you've had tiredness that's been ongoing for a while, then please do get it checked out. Okay, so moving on to sign number 4, and that's all about cravings. But look, it's quite normal to have cravings now and then for certain foods that you like, or certain memories that you have associated with food. Or for example, when you're coming towards your period, a lot of women do tend to like to have more sugary foods or also fatty foods. They're a lot more, well, they're craving those sort of foods more. Now, however, please do remember, if you are now suddenly having these cravings that you've never had before for some really unusual food combinations or certain things that you never really liked that much and you're suddenly having cravings for it, plus the other signs that we've mentioned so far, this could be a sign of pregnancy, so please remember that. Now, not all pregnant women do have cravings, but if you are the type that is going to get the cravings, they usually start from about week 5 of pregnancy up until the 3rd trimester, which is about 28 weeks. And one really important thing to remember, that sometimes when you have certain vitamin deficiencies, you may start to crave non-food items. If this is the case and you start craving these sort of things, then definitely speak to your healthcare professional so they can do some tests and check if you're deficient for anything. Moving on to sign number 5, waterworks and bathroom changes. Now, there's lots of things that can affect how and when you pee or go to the bathroom. This includes after eating certain foods, or if you drink a lot of fizzy drinks, alcohol or caffeine. You may also experience bowel changes if you suffer from food intolerances, celiac disease, or irritable bowel syndrome. However, when you are pregnant, you may experience that you're going to the toilet a lot more to pee. This usually starts at around week 8, where the womb is about the size of a lemon, and it's going to put pressure on your bladder, which is going to make you pee more. You may also notice certain changes as well in terms of constipation. You might be getting constipated more often and have more vaginal discharge. Now, please do remember though, if you are having vaginal discharge which is smelly, or it's a different color, it's green or yellow, it's unpleasant, it's itchy, it's stinging when you're peeing, all of these could be a sign of something else that needs treating, so please do speak to your healthcare professional to get that checked out. Now, moving on to sign number 6, sore and tender breasts. Now, before we move on to that, there's lots of things that could potentially cause this. For example, unsupportive bras, if you've had an injury, if you're on certain medication, there's loads of different things that can actually cause this. It's also more common if you're on the contraceptive pill, or if you're approaching the menopause, or if you're about to have your period. This can be quite common as well, probably one of the most common reasons as well for soreness in that region. So the question is, how can you tell the difference between pregnancy and the other stuff that we've just spoke about? Well, when you are pregnant, your breasts will usually grow at least 1 or 2 cup sizes. Also, they're going to feel tender, your nipples will feel more tender and a bit tingly as well. The areola, which is the area around the nipple, can sometimes get darker as well, and the breast can get more veiny as well because of the growth and the blood that's circulating in that region. And sometimes you can have a bit of discharge from the nipples as well. These are all signs to be aware of. Now, please do remember though, any discharge from the nipples, it could be a sign of something else as well. So in case you aren't pregnant or you think you might be pregnant, again, it's a good idea to get it checked out by a healthcare professional and have a word with them. Now, moving on to tip number 7, which is all about a metallic taste in the mouth. Now, please remember, this isn't one of the most common symptoms like the ones that we spoke about earlier, but some pregnant women do experience it. But please do remember, a metallic taste in the mouth can be caused by various different reasons as well. Certain medical conditions, gum disease, for example, or if you're taking any medication that can sometimes cause it. So there's loads of different reasons for it as well. Now, some people may find that their taste changes as well. They may have heightened sense of smell and become more sensitive to fragrances and odors. Now, please do bear in mind as well, the time this video is being filmed is during COVID-19. So again, remember, if you're having any change in your taste or smell, this could potentially be a sign of COVID-19. So please do check your local guidance on what you need to do about that, whether you need to get a PCR test done or check your other symptoms. I will leave more information about that as well in the description below for you. And moving on to sign number 8, a positive pregnancy test. You can get a pregnancy test from anywhere, online, supermarket, chemist. They're relatively inexpensive and very, very easy to use. Now, please do remember, however, yes, pregnancy tests are accurate, but sometimes you can get what we call a false negative. So you might be pregnant, but it's giving you a negative result. If this is the case and you're having all the symptoms that we spoke about, then redo the test in about a week's time to double check if you are pregnant or not. Now, there is also such a thing as a false positive as well. So it's showing that you're pregnant on the pregnancy test, even though you're not. However, this is far, far less likely to happen. And by the way, if you do have a positive pregnancy test, most likely you are pregnant. So please read the information leaflet that comes with it, learn how to use it properly, because they all vary very slightly. So if a lot of these signs apply to you and you think you might be pregnant, speak to your healthcare professional straight away and they can start giving you the best advice on the next steps. Finding out you're pregnant can be an emotional time and some women may feel very anxious. So in the description below, I'm going to leave links to some super useful charities and websites that can help guide you through what your options are and what you can do to get help. And if you do think you are pregnant, please, please, please stop smoking if you do smoke and stop drinking alcohol straight away. These are two of the most important things that you can do. And in addition to that, you can start taking a folic acid supplement. Again, I'm going to leave more information about that in the description below for you to read. You should also eat a healthy, balanced diet. There are certain foods as well that you should avoid whilst pregnant. And again, I'm going to leave a link to it in the description below. But when you get referred to the midwife services, the midwife will go through all of this with you in lots and lots of detail. Now, if you're not sure that you want to be pregnant, your healthcare professional can discuss options with you. They are there to support your health and provide advice, whatever your decision. There's also confidential sexual health clinics and charities that can provide education services and guidance. If you're over the age of 13, these organizations won't force you to tell your parents, and I'll leave loads more information about them in the description below so you can find out more. So it looks like we've come to the end of this week's video. You now know about the 8 signs that could potentially indicate that you're pregnant, so you're a bit of a pregnancy pro. So tell your friends, tell your family, tell your loved ones, tell whoever you need to tell, because you now know. So I'll see you next week, and always remember, you're awesome. Hey guys, thanks for watching this week's video. Make sure to click that like, follow or subscribe button now to stay up to date with new weekly videos.